Thank you so much for joining us. For the second day in a row, HIV makes headlines here in the tri-state. Yesterday, we heard that Hamilton County cases were up.
Now, the Northern Kentucky Health Department says the same thing. Officials on both sides of the river actually tell us the opioid epidemic is to blame. I spoke with a man who really takes the news to heart because of his own path. Medicine is part of Scott Ford's daily drill.
So each night I take Prescobix.
He showed us doctor visit paperwork that says he lives with HIV. He got that diagnosis, he says, when he was just a teenager.
It was the scariest day of my life. I had a lot of time to think. If I had to do all over again, I would have made a lot different choices.
Scott says his risk factors included unprotected sex and needle drug use. When he hears the latter is playing into a recent spike in HIV cases here in the tri-state, it really bothers him. Why does it trouble you?
I don't want to see someone my age go through what I went through. The numbers shouldn't be where they are. We should be seeing a reverse in numbers.
Health experts agree. They say they're trying to stop the trend in its tracks. Listen in on this news conference from earlier today in Northern Kentucky.
Our efforts right now are focused on finding folks who may be at risk, getting those folks tested. One of the things that we talk about in public health is that treatment is prevention for HIV. So the more folks we can get into treatment and on medication to manage their HIV, the less likely it is that the disease is going to spread.
And speaking from his own personal experience, Scott has this message.
If you are an active drug user, if you are involved in the party scene, hit that reset button and take control of your life.
But he knows how hard that can be. So here are the numbers. In Northern Kentucky, there were 37 reported cases of HIV in 2017. That is 12 more than the previous year. And people reporting IV drug use as a risk factor went from 5 to 18 in that same time period. Hamilton County reported 184 HIV cases last year, up from 137 in 2016. That's an increase of 34%. Proposed fixes for the spike now, encouraging HIV and Hep C testing for at-risk people, along with expansion of clean needle exchange programs.